Tell me more about what you saw there in terms of the therapists facilitating these identity disorders. Tell me why you became curious about that generalization. And then, most painfully of all, explain what you discovered.
Sure. So in researching bad therapy, I first of all, I started out with a totally different hypothesis. I knew that these kids were getting more mental health intervention than any generation prior, the rising generation. I knew that they were getting more diagnosis and more psych meds and more therapeutic intervention in schools. But I still didn't think therapy was necessarily the problem, because while 40% of them were getting therapy, it still wasn't a majority. And yet we'd seen their mental health fall apart. We knew that the rise in therapy and therapeutic intervention was somehow coinciding with worse mental health. That of course shouldn't be the case. Like with breast cancer, more access, more treatment, better treatment and more access to it has seen, rates of death from breast cancer plummet. And that's what we would expect to see with mental health. And we're not seeing that. But I still thought, it was possibly just the way kids were being raised. Maybe they were being raised differently, or perhaps it was just a smartphone. And then I began to look into what the iatrogenic effects of therapy are. What are the ways that therapy can hurt you? And there's a literature on this. Unfortunately, it's not a literature most therapists want to acknowledge. They want to claim that therapy has this amazing power to heal, but that it can never hurt. And of course, there's no treatment for which that's true. Anything, Tylenol can damage your liver. Anything that can help can also harm. And so I began to look into, were these kids getting a lot more therapy? And not only were the harms we were seeing in this generation, the lack of agency, the listlessness, the family alienation, the anxiety, depression, all effects of, iatrogenic effects of therapy, harmful effects of bad therapy. But we were seeing this, it was being applied not only from actual therapists, but all over the schools. And from parents. Parents were having therapists guide their parenting, and schools were having therapists do trauma-informed care with all the kids. So I started realizing that these kids were getting a lot more psychological intervention than I realized, and that it was bad. So we know that the risk of iatrogenesis, of the healer introducing a harm, is greatest when you're treating people who don't need the treatment to begin with. Okay. So we know that if you're gushing blood, going to an ER is an important thing to do. It's necessary. It's life-saving. But if you have a small bruise, you're much more at risk of getting an infection from the ER, picking up, a MRSA or some other bacteria from an emergency room visit than you are then you stand to benefit. And the same is true with preventive care. We shifted from treating kids and treating adolescents with severe mental health problems to the idea that everyone should have therapy. And there we exposed a vast population to the risk of all the known harms of therapy. Now, I'm not someone who's against therapy. I'm not someone who denies that it can be important and very useful and even curative. But when you treat kids who don't have a severe problem, you're at much greater risk that the therapist will just introduce harms. And I saw it firsthand, certainly with the kids who convinced themselves that they were transgender. Very often with a therapist, the idea was reified. And we see that across the board, from everything from anxiety to depression, family alienation, the loss of a sense of agency. We're seeing in the rise of generation, they have an external locus of control in rates we've never seen before. They don't believe they can improve their own life, and they are highly treatment dependent. They think they have to call a therapist or an adult before they make any decision. These are young adults who feel that they can't make a decision in their lives. So we're seeing a lot of the harms that therapy can cause. Those are the same ones that plague the rising generation.